So, hi guys, welcome back. Today, under the cardiovascular system, we're talking about acute rheumatic fever. So, this is an acute systemic connection tissue disease related to an immune reaction to untreated group A beta hemolytic staphylococci infection of the upper respiratory tract in children. So, the major complication of this disease is cardiac involvement, which can eventually lead to severe heart valve damage. So this is the commonest cause of heart disease in most Kenyan children. And the initial attack is acute rheumatic fever, which occurs in the most cases between the age of 3 and the age of 15 years. So what are the clinical features for acute rheumatic fever? So migrating polyarthritis, carditis, which is signs of cardiac failure. So persistent tachycardia, pericardial rub, and a heart murmur. So we also use the Siddingham's chorea, arrhythmia marginatum, and subcutaneous nodules. So the minor criteria is past history of rheumatic fever, raised ESR, fever, arthralgia. We make a diagnosis by getting two major clinical features or one minor and two minor manifestations. So if patient presents with these clinical features, what are the investigations that one is supposed to take? So first of all, we do antistreptolysin zero tire, which the rate is 1 is to 300. We also have to do a throat swab for B hemolytic staphylococci group A for C and S. We also have to do an ESR. We do a chest X-ray to see features of cardiomegaly. We also have to do an electrocardiograph and an echocardiography. So how are you able to manage this condition? So we are supposed to eradicate staphylococci infection from the throat by giving amoxicillin to 50 milligrams to 500 milligrams. In children, is 25 to 50 milligrams per kg in divided doses. So this can be given thrice a day for 10 days. So if the patient is allergic to penicillin or amoxicillin, give erythromycin 12.5 milligrams per kg QID for 10 days. So we're also supposed to control fevers and inflammation by giving aspirin 75 to 100 milligrams per kg per day. So in 4 to 6 divided doses. So treatment continues until fever and joint inflammations are controlled and then generally reduced over a 2 weeks period. So treat chorea if present with haloperidol 25 micrograms per kg, that is 0.025 milligrams per kg, 3 times a day. We also admit for strict bed rest until the symptoms get to resolve completely. So what are the preventive measures for this condition? First of all, you are supposed to avoid overcrowding areas so that you reduce the risk of infection. So early treatment of staphylococcal sore throat with benzathine penicillin, that is 1.2 mega units start dose, or phenoxymethyl penicillin, 125 to 250 milligrams TDS for 10 days. What are the prophylaxis measures that one is supposed to take when encountering this condition? So if there has been any previous acute rheumatic fever with carditis, you're supposed to give benzathine penicillin, 1.2 mega units monthly for 5 years or up to the age of 18 years or longer. So erythromycin 125 to 250 milligrams twice a day for 5 years for those sensitive to penicillin. So if there has been previous acute rheumatic fevers with carditis, you give benzathine penicillin 1.2 mega units or erythromycin 125 to 250 milligrams BD for those sensitive to penicillin for life. For the patient's health education, you're supposed to emphasize the need for follow-up for prophylaxis measures, and also you advise that rheumatic heart disease is a known complication of this condition. Thank you. I think we can be able to manage acute rheumatic fever at this point. I hope you've learned something. Thank you very much.